to be candid, premiers asking for more money for healthcare from the federal government is not new. My question to you, is it realistic to say we need more money after the federal government just gave $19 billion for the Safe Restart program, much of that for healthcare?
Well, walk, chew gum, same time. You know, Canadians are across the country able to multitask. I've got friends who are unemployed who are looking for work and trying to figure out how they're paying their bills at the same time. I've got people that work now from home, never did before, trying to help their kids, learn how to learn from home. They can multitask. So we got seniors across the country that are, lonely, and they're waiting for a hip or a knee or a cataract. So look, everybody else is multitasking. I think the Prime Minister needs to do it too. I don't think you should use this pandemic as a reason to delay something that is so incredibly important to, now we think, well over 1.25 million Canadians. So let's get at it. But the
kind of money you're asking for, I'm just trying to figure out if it's realistic. Look, I remember when Stephen Harper was in power and there were increases, but then not at the same rate. It was at the increases at the rate of growth. That seemed to be acceptable. This government has kept that. Why suddenly the kind of increases, and I believe me, I know the history of this, the federal government is now down to 22%, but it's, people say 50-50, but there's a different system, there's tax points, and it's a little more complicated. Do you really believe that given the circumstances and the transfer of $19 billion for Safe Restart and other programs, that you're going to get another, $38 billion?
Well, it's a question of priorities, I suppose. I mean, Minister Freeland just announced interim extensions of business support programs that add up to about half as much as we're talking about for healthcare. It's a question of priorities. I think the willingness to address any issue depends on the magnitude of your understanding of how it's impacting on people in politics. To say that this is hurting people is not really to understand the magnitude of how much. People are waiting in pain, on average, according to Canadian Institute of Health Information, about 2.5 times as long for basically every service as they were 20 years ago. So look, it's an issue of every day is a struggle for hundreds of thousands of Canadians, and it's not going to go away. We got a pandemic here that's going to create a pandemic pileup on a situation that was already bad. And so the longer we ignore it, the worse it's going to become, because our population isn't getting any younger.
But what about the federal government has said, okay, look, we want to do things. There's been provincial failure on long-term health care. We're interested in national standards. If we're going to give more in health care, we'd like to put strings attached to it so we know, like Paul Martin did, when he was dealing with wait times. You have rejected strings attached. You and the province are saying, just give us more money, but it's our jurisdiction. Well, clearly it's a shared jurisdiction if you think it's federal responsibility as well. Why reject having strings attached to the money at the same time say it's their obligation to give you the money?
Well, first of all, you understand the constitutional stuff, so I'm not going to go back to that, except to say that this is a provincial issue of delivering health care, and that the federal government has, for generations, been a partner in funding health care. That isn't to suggest that it's either or. Look, we're working with the federal government right now on strategies to improve our PCHs, so I think other provinces are too. But it isn't just one or the other, Evan. I think it's more complex than that, as healthcare is complex. I think the underlying reality, though, is we can't sustain it. Every study says this at $1 out of 5 approximately coming from the feds. It won't work. And the Liberals, remember, took the position when former Prime Minister Harper decided to reduce the supports. They said that was wrong. Then when they got to government, they changed their mind. Well, it's time to change your mind back, because we have a new reality now that needs to be addressed. And it's been understood by every single study that's been undertaken, some of them by the Liberal Party themselves, that says this isn't sustainable. The provinces cannot deal with this without federal increased partnership.
What did you mean when you gave this anecdote today? And I know all the premiers were telling personal stories about people who are suffering, but you're saying, people can't get health care. You said you were talking to the Prime Minister, and you said Justin Trudeau said, I'm not your banker. Now, we've called the Prime Minister's office about that. We haven't been able to verify that. Why did you tell that story? What do you think he meant by that?
Well, I think he was frustrated. Look, the meeting that we were at was in December of my first year as Premier and his first year as Prime Minister. This isn't a whack on the Prime Minister to suggest that the fact of the matter is, the key to decision making is having empathy for the people involved. And his response when I told the anecdote, which I won't get into right now, but which I told in the press conference earlier about an individual, a woman who went to stage 3 because of delays, frankly, stage 3 cancer because of delays, he looked at me and said that. And I was shocked by that response because it isn't about being a banker, it's about being a partner. And it's about having the empathy to understand there are real people involved here and they are being impacted by delays. And those delays are hurting people in a big way. Every single day that a person waits for a test result to determine if they have cancer is hell.
Okay.
And this is what we're doing right now because we're not in a partnership that's going to sustain healthcare, and that is what every single study has said.
Okay, well, let me present it. Since we're swapping studies, there was a study by the Center of Policy Alternatives that said half of the provinces, including Manitoba, haven't met the 50-50 cost-sharing stipulation attached to municipal supports for the Safe Restart Agreement, and amidst the crisis in the long-term care, and I'm quoting them, 6 out of the 10 provinces, including yours, don't have sufficient plans in place to access the full amount of federal long-term care funds. In other words, there are trigger funds from the federal government's provided that your province is not actually meeting your cost-sharing stipulation to access those funds. And I only say that because when we're talking about who's the banker, in the crisis, even in your province, I think the province provides $1 for every $8 the federal government is providing. So can you explain, if you guys aren't putting up the money, why you want more from the federal government?
Well, we don't run healthcare on the federal government's schedule. Every province is different. Every province has different priorities, and every province is addressing those priorities as best they can. The short-term realities of the partnership with Ottawa during the pandemic, I think, are demonstrable. The successes are demonstrable, and the whole exercise has shown us what can happen when we work together as a team of people.
Right.
Now we need to do the same thing on the longer-term underlying problem, and with a minority government in place, I know that this is a challenge. I understand that. I've been around Ottawa politics. You have long enough to know that minority governments tend to want to be worried about the short term. That's the nature of minority governments, especially approaching an election. But this is an underlying foundational problem that needs to be addressed, and it cannot be addressed by short-term thinking.
Manitoba Premier Brian Pallister, great to see you.
My pleasure, Evan. Nice to talk to you.